Thank you all for coming. We're here for Uniting Knots, which is a collective that's aimed at fostering cross-sector collaboration with the aim of sort of addressing some of the systemic societal challenges that we've got.
Following on from United Knots, one of the key themes that came out from that discussion was mental health.
Events like this are crucial because it brings together key people working in mental health from a community and social setting.
What we're doing today is a roundtable discussion with bringing key individuals from different sectors together.
I'm Chief Inspector for the City Centre.
The University of Nottingham Counselling Service.
The Mindtech Research Group.
Today is really about how do we strengthen partnership and think about solutions together.
My name is Tinashe Chipawe. I'm a late diagnosis, mental health challenges. From my perspective, I'm bringing lived experience. So I think listening to my story could potentially trigger that change that we need.
Everybody has mental health challenges at different levels, but that kind of means that it's everybody's business. It's not just something for the NHS, it's not just something for schools. I think as communities we all come together on a human level to understand how we can work together.
Events like this are pivotal. I've been working with Switch Up and Marcellus Bass for several years now. It's about opportunities really to share experiences, look at learning and see how we can improve the offer to people with mental health.
It's not just about talking about issues that are really, really important to Nottingham and Nottinghamshire, but it's about creating really, really definitive action from all the events that we host.
Change will only happen if you get a group of people together who want to create that change. And why are they creating that change? It's not for profit, it's to support, and it's to support the generation that's coming behind us.
Hope is absolutely the fundamental thing that Uniting Knots is all about. We want to enable collaboration, we want to drive the conversation, we want it to be purposeful. If we can bring that hope and those conversations that really resonate with people and really drive impact and deliver them to the people that matter, that's what Uniting Knots is all about. Uniting Knots is a collective that's aimed at fostering cross-sector collaboration. The initiative brings together leaders from the private, public, voluntary and education sectors. This is our second roundtable event, which is going to focus on issues around knife possession, violent crime and reoffending and how that is affecting our communities.
Today's United Knots, it's really looking at bringing different sectors together and looking at gathering insights that would really help us to be able to look at, real tangible solutions.
We see about 40 to 50 major traumas a week, and on average we're doing 1 to 2 emergency operations for knife injuries a week. If all we do in our team at the university, at the hospital, is stitch people up when they've been injured, then we feel like we failed. So I've come to represent them to try and be part of the solution.
I'm passionate about it because I believe that it's solvable. I believe it's not inevitable. I believe that we can change this, but fundamentally we're getting some things wrong, and we're getting those wrong as a society as a whole.
It's really inspiring to hear people with different lenses and different views and different levels of expertise around the problem, and that's the only way that I think we can challenge ourselves to improve. It's not a policing problem, it's a societal problem. I'm Suk Verma, I'm the Assistant Chief Constable here at Nottinghamshire Police.
I'm Professor Kevin Brown and I'm here as an expert in youth offending and knife crime.
My name is Obi Elvis Okobara. I moved here when I was 13, turning 14. Slowly got into the knife crime.
I'm Head of Strategic Partnerships and National Delivery at MTBH, a housing association.
HMPPS. Prison and probation.
I'm a consultant in major trauma and emergency surgery at Nottingham University Hospitals.
We started the Danny C Foundation after my brother was stabbed to death.
United Knots has brought people together that otherwise would never be together.
Unique that they come together with one voice. We're all facing the same direction really, we want the same outcome.
And we've got 2 politicians that are going to take this to Parliament. And if we can get these politicians lobbying, then we can start changing policy. Then we can address systemic and structural issues, and that's what United Knots is all about.
Good morning everybody and welcome to the concluding event for Uniting Knots.
I'm absolutely ecstatic, mate. When we started the initiative, we believe that coming together can make changes.
Attending the first meeting of Uniting Knots a year ago, The room was full of people of influence, but not really a clear view on where this thing was going to go. And what's really impressive a year later is something that was amorphous has now turned into something that's really structured with definitive action to take these points to Parliament.
I'm extremely proud of what's been achieved. I'm extremely proud to be involved. It's difficult. People are losing their lives at the end of the day. And it's heartbreaking. People genuinely care. People genuinely want to see change. We all have to come together.
Today we're here to celebrate the success of United Nuts. It's a new initiative and it's working. Our insights have been shared with the Home Office report commissioned by the Youth Endowment Fund. That's going to shape national delivery and influence policy. And that's what we came here to do.
Well, it's amazing, you know, we're having an actual influence at a government level. This is now showing that this model works. Like, look at what we're doing, this is successful.
At the end of the day, it's about communities. The spirit of Nottingham is why I'm a Londoner. First of all, I come from London. I came here and it was a warm, lovely, welcoming city. And I've been here for the last 40 years. That community spirit is what we're trying to keep and improve.
The journey with the initiative is ultimately to make things safer for our young people in the community. We have thinkers, doers, strategic leads and operational leads who've come together to feed into what will be a response. To pull that together, I think, is so amazing. Very proud, very proud.
Collectively is what it's about. I think you can achieve so much more collectively. When you pull the private sector, the public sector, businesses, and you pull them all together and use all the resources you can, that united front is where it's at.
I feel quite choked up, to be honest. Very moved by this and determined to take this letter and these demands to ministers. You know, these are the things that I've been fighting for since I was first elected.
United Nuts should be so proud of what they've done. My role now is I've received the letter around mental health. I want to make sure that that's communicated properly to the Department of Health. It gets in front of the relevant ministers, that I have those conversations, and really we do our utmost to take that agenda forward and put the maximum amount of effort behind that.
The priorities outlined in this letter are so important. This is the systemic structural changes that we need, and it's a real privilege to be entrusted with this. As individuals, we don't have that much power, but when we come together collectively to demand these changes, that's when we can make a difference. You've seen it today, it's been incredible.